Good afternoon, everyone. We're just waiting for the participants to join. So we'll get started in just another minute. Okay, I see people joining. So why don't we get started? Good afternoon, everyone. Today is January the 14th. My name is Shannon Bott. I'm the Executive Director at Digital Health Canada. I'd like to begin by acknowledging the Indigenous peoples of all the lands that we're on today. While we meet today on a virtual platform, I'd like to take a moment to acknowledge the importance of the lands which we all call home. We gratefully acknowledge that we're on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaties, signed with the multiple Mississauga and Chippewa bands. Please share in the chat the territory you're joining from. So, welcome to everyone. Welcome to our new series, In Conversation With. We look forward to bringing you content in a different format. The series will run periodically through the year with a moderator or a host having a discussion with one or more individuals. It's a chance to share experiences and ideas, and perhaps a place where Digital Health Canada can provide updates or gather feedback. Today, we're in conversation with Anne Forsyth. Anne Forsyth is the Director of Clinical Applications and Decision Support at Women's College Hospital, bringing over 15 years of leadership experience in healthcare and health information management. She holds a Master of Science in Health Administration from the University of Toronto and has held roles at key organizations, including the Canadian Institute for Health Information, eHealth Ontario, and Cancer Care Ontario. Anne is a member of the Digital Health Canada Board of Directors and is the current vice chair. Welcome, Anne.
Thank you, Shannon. Welcome, everyone. In 2025, Digital Health Canada is celebrating our 50-year anniversary of connecting, inspiring, and empowering those enabling digital healthcare in Canada. In honor of Digital Health Canada's 50th anniversary, we've invited our members to this special interactive session with our newest Digital Health Canada Fellows, Hélène Clément, Rodney Burns, and Ted Scott. Together, our esteemed panelists will reflect on their remarkable careers in digital health and share their perspectives on how Digital Health Canada has supported innovation and growth in the field. Today's discussion will explore the evolution of Canada's digital health landscape and offer unique insights into what the future holds for our industry. It's now my pleasure to introduce our presenters. You can read their extensive bios on our website, but let me just provide you with a little bit of information in case you don't already know them. Starting with Hélène Clément, who is a senior consultant at the HC Group and a strategic thinking healthcare professional with over 30 years of experience in digital health. Hélène has been on the Digital Health Canada Previously Coach Board of Directors for 4 terms and has contributed a significant amount of time to many activities to advance digital health. She's also CPHIM-CA certified and has maintained her certification for over 15 years. She's been instrumental in developing learning guides and mentoring others to achieve the CPHIM-CA certification. She's also been recognized for her contributions on the Digital Health Canada Board of Directors in 2020, the Coach Board of Directors in 2014, the Women Leader 2019 for Digital Health in Canada Award, and is a recipient of the Ontario Nursing Informatics Group Achievement Award in 1994. She's committed to the vision that digital health is the key to better, safer, and high-quality care, and the key enabler for transforming the delivery of healthcare services. Through her numerous involvements with Coach and Digital Health Canada activities on committees and in her current role, she continues to actively contribute to making digital health transformation a reality. Next, we have Rod Burns, who's a principal consultant at RJB Consulting. Rod received his bachelor's in medical physiology from the University of Western Ontario in 1988 and a master's of health administration from the University of Ottawa in 1992. He spent 15 years working in the hospital sector in Ontario and 3 years in the NSM LIN environment. Through a 30-year career, Rod has held senior leadership positions in information management portfolios, developing and implementing multiple IS and corporate strategic plans. Rod is active in the professional community and a strong believer in ongoing leadership development. His current professional interests lie in consumer health, health system leadership, digital health, and institutional knowledge management. He continues to support health service leadership development through his ongoing involvement as a CCHL-CHE program evaluator and fellowship program evaluator and mentor. He's also a member of the CCHL Fellows Council. And last but not least, we have Ted Scott, who is the Vice President of Innovation and Partnerships at Hamilton Health Sciences. Ted Scott founded Hamilton Health Sciences Innovation Function and has established the hospital as one of the leading Canadian hospitals in the development and responsible use of AI in healthcare. He was previously Chief Innovation Officer and Dean of Applied Research at Mohawk College, where he founded IdeaWorks, a college-wide research and innovation program, and rolled out a college-wide blended learning initiative. Ted is an expert digital health strategist and has a wealth of experience in industry relations and commercialization, as well as innovation policy. Ted is a lifelong learner who earned his Master of Applied Science in Medical Ultrasound and his PhD in Diagnostic Imaging from Charles Strutt University of Australia. Welcome to all of our speakers, and thank you so much for being here today. To those of us who are joining us for this session, we will have time for Q&A at the end of today's presentation, so please put your questions into the chat box, and we'll be watching to make sure that they do get addressed in the Q&A portion of this session. So let's get into it and soak up some knowledge from these great minds who are with us. I'll just start with a little bit of reflection. So 50 years ago, which is the anniversary that we're celebrating this year, a group of Canadian leaders in the IT field came together to create what we now call Digital Health Canada, a Canadian organization concerned with Canadian problems in healthcare computing, to provide ideas, advice, and leadership to hospitals, government agencies, and medical associations in relation to health IT. This was the same year that Bill Gates founded Microsoft. The prototype for the first Apple personal computer was developed, and the groundwork for email communication began to form. These milestones represent the start of something big, something transformative. I want each of you to think back to your early careers and tell us about that turning point moment. Describe the event that started your journey in the digital health field, and what excited you the most about the possibilities that were ahead of you in digital health. And Ted, we'll start with you.
Yeah, thanks so much, Anne. I wanted to appreciate the opportunity you've given us to share some of our, I think, really interesting experiences, maybe a few lessons learned along the way. I actually have 2 turning points, but I'll try to keep it fairly tight for you. I began my training and my first part of my career in medical imaging, and it was a pre-digital era. Well, not exactly, but in practice, we were using film, and we were just learning about some exciting new things around body imaging that were happening in terms of CT imaging, things like that. So in 1999 was really my first turning point when I entered some leadership opportunities in teaching at Mohawk College. And that's when I attended my first RSNA event. So those of you that may have not attended RSNA, it's the world's largest imaging conference anywhere from 30 at the time. I think I went, it was around 50,000 attendees. And it just kind of expanded my horizons so dramatically because first, I'd been pretty narrowly focused in my clinical duties up to that point. But secondly, I saw the impact of global research, the impact of computing power that, at that point, even in the consumer context, was pretty much not availed of, or there was no e-commerce. Like it was like most people didn't have a computer at home. And so seeing them live stream, which is a hard word to use back in the day, live medical imaging from an MRI scanner in Germany on the Siemens showcase floor was just like incredible. It's so exciting for me because it opened up a new, huge opportunity for learning, but also for better image quality, new, procedures we could do, and so on and so on. So that was the first turning point. The second turning point, though, really was maybe not quite as like dramatic, but it's when I sort of began my journey with Digital Canada. I was leading some new research, applied research at the college, and my world went from imaging to broader global informatics and things that, like, I availed myself of Helen's work with CP HIMSS, and really started to see a much broader landscape of digital health than I had previously seen. And that was really around probably 2007, 2008. And it really sort of dug into interoperability and things like that. So two big turning points for me, I think, both very exciting. And the second one is when I really started to connect across Canada through Digital Health Canada. I know we'll get to that a little bit later, but yeah, those are my highlights.
Thank you. Thank you for sharing, Ted. Helen, let's go to you next with the same question.
Okay. Well, for me, the key turning point was I was working as a staff nurse in neurosurgery, and we were introduced to this box, which was called a computer, which made no sense from a clinician perspective. And so started complaining, and then decided, hey, I can't complain, so I might as well do something about it. So that was really, for me, a key turning point. So I became involved, and as a clinician, started to participate in some of the clinical transformation. And my first experience was, those of us that have been in the area for a long time will know what I'm talking about, the old IBM PCS system. It was among the first ones being introduced in Canada. And the organization I was working with, the healthcare organization I was working with at the time, we were starting to implement that. So I became more involved, I became more interested, and the key part for me was using this new technology to help us as clinicians work better and improve and spend the time with patients versus spending time writing notes and charts and et cetera. So transforming healthcare through the use of the different technologies. Then my second turning point was I didn't feel the technology were quite moving fast enough. So I became involved and started working with a vendor where I was able to develop, influence, and also put some new thoughts in the software that was being created. And therefore, again, using some of the data in decision making. So it was also, that was the second turning point, is working with technologists, architects to learn the skills. Then as a leader, as you get more and more involved as a clinician and a healthcare leader, my next goal was really to help staff through understanding, getting more involved in those technologies, because the more you're involved, the more you improve your working life, but more important, the impacts that you're doing on patients. Our goal has always been, as clinician, patient first. And patient first means you spend the time with them and less time with paperwork. So having information at the tip of your finger when and where you need it was instrumental. So I saw a need, and I wanted to transform the healthcare through different means, including education, development of software, and also make a more impact on those we serve, which is the patients as a whole. So really, for me, those were the two key ones. As a nurse, not knowing anything, and then wanting to influence and impact the vendors developing software.
Thank you so
Thanks a
much,
lot.
Hélène. That's great. I love that you took something that instead of complaining about it, you did something about it. That's
Well, yeah, and actually, I used to be a top complainer, and then one of my boss said, "Stop complaining and do something about it." I said, "Okay, well, I'm going to do this then."
absolutely.
And that was I have to say that there was a lot of clinicians at this point started to get involved, and I'm saying clinician, not just nursing, physio, OT, social work. Everybody was really getting involved more and more, and that was, for me, that was important, and providing them with the educational background.
Absolutely. Thanks, Hélène. And Rod, over to you. What was your turning point?
Oh boy. So what Ted and Hélène said. One, I absolutely resonate with those comments. My first turning point, I came out of my master's in health admin with a focus on finance and quality improvement, very data oriented, and realized as I went into the hospital sector what a mess it was. So I spent the first couple of years implementing the MIS guidelines, trying to improve decision making around case costing, and it was brutal. It's hard to believe I'm only 25 years old knowing how much gray I have, but that's where a lot of it comes from, is all this innovation creates churn and pressure and stress. And Hélène's comments about impact on clinicians is really relevant. So as I was starting my career, I got into supporting IT, had to merge two hospitals on a single HIS. The organization I was in had implemented a first time in Canada Australian system, and then the company turned around and said, we're not going into that market. So we had a white elephant on our hands and we had to move off of it, which was painful because I had to get all the clinicians on board. And frankly, the toughest ones were in DI, the radiologists, who are very transaction oriented. Efficiency is important for them to make sure that they're moving through the demand of studies as well as earning an income. I knew this was an important area when I was walking down the hall, and two specialists, different disciplines, stopped me and said, Burns, how come this HIS is not, hospital information systems, not working? It's clunky, it's hard, it doesn't meet my workflow, everything that Hélène was describing as well. And I kind of lost it, and it was right outside the CEO's office. And I said, look, dude, modern medicine has been around for over 400 years and you're still killing people. And I said, give me 2 weeks and I'll fix this issue. And the CEO came out, he was pissing himself laughing. He says, okay, let's make it happen. So that's really where I got into trying to ensure IT, digital, was an enabler of clinical practice, notwithstanding the necessary evil of capturing accurate data. And that relies on the clinicians to capture that. And really, information management is it captured in a way that can help with decision making in as close to real time as possible. I can remember doing health record studies for clinical utilization. It would take us a month to go through paper records and come back to a clinician and say, your length of stay is not adequate. You got to improve that. And he's going, but that was 2 months ago. So how to eliminate time and geography became key drivers for me as I got more and more into IT and digital health. The one big takeaway I had with working in finance and continuous quality improvement, the father of total quality management, Edward Deming, had a saying, and it's based off of the American dime. You see the bottom of it, it says, in God we trust. And he flipped it around and he superimposed, all others bring data. So that was my first introduction to evidence-based medicine, right? Don't just tell me, show me the evidence. So that was really what helped drive a lot of my introduction in the early 90s into IT digital as we know it today. The second pivot point for me was about 13 years ago when I became the CIO for a primary care organization, an association of all of the community health centers, Aboriginal health access centers, nurse practitioner-led clinics, and some community-governed family health teams in the province of Ontario, about 110 members. And it was my job to help deploy systems out to those folks. And it really resonated with me in that we're turning the pyramid upside down, where hospitals had really started to anchor and advance digital health. The value proposition is avoiding acute care if you can. Can you go upstream and use tools like digital to actually identify needs before they become acute? And that's huge cost avoidance and affordability. I'm not saying you don't need hospitals. I'm not saying we don't need emergency services. All I'm saying is, how do we engage at the primary care level? And digital can remove time and geography as a barrier, right? So, you know, we have 211 here. People will call that Friday night at midnight. Their baby's colicky and crying, and mom's stressed and tired. What do I do? And oftentimes we're told, go to Emerge. Very expensive. So if we can mature some of these technologies to reach people when they need it or before they're in an emergent state, all the better. So for me, those were the two pivot points. And I spent the last 11 years of my career trying to build digital literacy in communities so that the clinicians at the neighborhood level could communicate without imposing the need for an in-person visit. Remember, this is going through the pandemic as well, which was, you know, a cloud with a silver lining in many ways to push virtual visits forward, just like we're doing with Zoom today right across the country. So, you know, necessity can be the mother of invention here. And, you know, grabbing that and taking advantage of it, we were able to secure 2,000 basic cell phones with internet capability and deploy those to communities and individuals in need so they could do virtual visits and not have to leave their precarious employment for an appointment, if you will. Very hard to do. So that's what I spent the last 11 years of my career on, and was the basis of my fellowship with the Canadian College of Health Leaders. I'll talk more about that at the next question.
That's great. Thank you. And I find it so interesting that all three of you touched on topics from early in your careers that continue to be challenges in healthcare today. And so we'll talk a little bit more about the future of digital health and healthcare in a little while, but let's continue on in our reflection journey a little bit longer. And I'll ask each of you to maybe share what role Digital Health Canada has played in your careers. Everyone on this call is a member, and, you know, we're a community of professionals working towards very similar goals. So interested to hear how this community has shaped your perspectives. And Ted, we'll start again with you.
Well, thanks so much. Digital Health Canada played an unexpected role for me. So up to that point, I'd had quite a bit of experience with communities of practice in back in my imaging world. But once I entered into the world of Digital Health Canada, I started to see so many new things in different jurisdictions. And honestly, like within the community, I've always had that experience of a bit of camaraderie and sort of shared challenges and things like that. But now I was kind of seeing it on a much, much grander scale. And so, you know, at times the community has been a great resource for just answering questions. Other times it's been great in terms of encouraging me to say, like, you know, some jurisdictions kind of figured this out and most of us haven't. And what would better path forward look like? So like from a strategic lens, the community's been really, really helpful, because on the one hand, you could see like, okay, that approach is not going to work here because it didn't work there, and I can see why. And then on the other hand, maybe there is a possibility that what they're doing over here could work where we work. So like, I just think that ability to sort of phone a friend and leverage those connections and networks, not just for the traditional things, but also even in your everyday work. So that's been tremendous for me.
Thanks, Ted and Helen.
For me, it was, as you know, Coach, the precursor to digital health. I had the privilege of knowing some of the key founders like Stephen Husing and Roger Girard and Brian Shorter, and there's a number of others. But through them, they introduced me to the organization. And what I learned from them is that through working together, meeting with different people, exchanging ideas, Definitely, it really helped me. It was that informal learning and training from peers within the organization that really helped me develop. You can learn so much from books, but you cannot learn experience and hands-on knowledge from books. It's really from people working, exchanging ideas with them. Um, Coach, now Digital Health, they were really my mentors. They helped me expand my skills. They help me develop myself as a health information professional, and they help me how to learn from other healthcare leaders. And it's the how to learn from them that I think was really, really instrumental for me. So without Coach, now Digital Health, I wouldn't be where I am today. They were really key from that perspective. It's the informal learning that is the most important learning of all. That's from my perspective.
Well said. And Rod, over to you. You put a test in the chat for people I see.
Yeah, I have always been, acronyms are great, but short forms mean a lot of different things to different people, right? So, my egg on my face was LOL, right? What does that mean? Laugh out loud, long live, whatever. So, understanding these acronyms is important if you're going to use them, but making sure the interpretation is right. I used to test my IT guys. What's TCP/IP mean? And you'd be surprised at how few could actually tell you what those acronyms. They understood the concept, but didn't know the fundamentals behind it. So I always used to go back and learn from the past. So out there for our participants to see if anybody's old enough to remember what the COACH acronym stands for. Throw it in the chat if you can. For me, as it was, again, kind of like 3 gears in my career, as I was starting out as a new professional, it was learning opportunities and being exposed to those deeper in the, well done, Christine, you got it. There we go. Excellent. Good to see people are paying attention. But it was for me really being able to enhance my learning, because when you're doing, middle leadership in a hospital IT, it's a lonely place, let alone at the executive level. Yeah, and so who do you learn from? So having forums you could go to for conferences, what was then very crude webinars, but still reduce the cost. You didn't have to travel to be able to ask questions of experienced mentors in the field. So learning, even leadership. I got involved in local groups. I got chapters for hymns and those types of tables, and also things, being able to do presentations, what's going on in your organization, and finding out how others had addressed similar issues, and learning, because there's lots of challenges, but many different ways to approach them. So it was good insight. And then as I got into middle career leadership and senior leadership, it was giving back, mentoring, and seeing what the thinking was coming up from fresh new eyes in the industry and emerging leaders as well. So for me, Coach and Digital Health Canada have provided opportunities for a voice of issues that are going on the ground floor in my organization or in my region or in my province, and creating that national mosaic of perspective, which is incredibly important when you're innovating in a space like digital health, which is still the new kid on the block in many ways. So you got to raise profile, having a voice, and being able to network and connect with folks and follow up and go, let's talk a little bit more. I'll buy coffee and let's go and actually have a chit chat about how you guys at your organization address that issues. So for me, it's all of those things, because I have been very committed to lifelong learning. I'm still in that space, and really that's what I've done over my career, is constantly look to others to help me understand how I can move forward.
Amazing. I love the thread that kind of went through all of your responses, which is around the informal communication, that sort of the thing that binds a community together, being able to pick up a phone and talk to a friend. And as much as we like to think we're unique and our challenges are unique, as you start talking to one another, we realize we're actually all facing the same thing. So it is invaluable, that support that exists. All right, so let's turn our attention a little bit to the future. We've done a lot of thinking about the past. So, with our 50th year anniversary, and while it's important to reflect on the past, one of the most important things that we do as digital health professionals in our day-to-day roles is to think about the future and how we can transform healthcare and make it better. So I'd like to ask each of you how you see the digital health industry in Canada growing, changing, and taking shape in the next 50 years. And Ted, again, we'll start with you.
Thanks so much, Anne. And I'll just add a caveat here because of my innovation focus. My comments will be sort of reflective of my deep dissatisfaction with the status quo. So take into account, that will definitely flavor my comment here. But I think one of the biggest things you'll see is a redefinition of the role of the patient and more as a partner in the healthcare experience. So I'll give you an example. Traditionally, healthcare has been delivered in a very kind of top-down, institutional-centric way. You show up somewhere, they do something to you, and you go home. But I think where we're seeing, and this is not just a health thing, it's a broader global thing where people are more empowered to ask questions, they have more information through the internet. And now we're seeing equally huge pressures on organizations to reduce length of stay, to reduce the requirement for travel, leverage virtual care. So hospital at home is a good example where you're going to see many more traditional hospital-based activities occurring now in the home setting. And this means that patients will need more resources, more education, more tools, and more availability. What's exciting about that for me is that the patient now is much more an equal partner and has much more sovereignty in the decision-making of, whether they receive a treatment or don't receive a treatment. So that's all for the good. And I think that's definitely a future direction. And the other two may be less exciting, but a lot more modernization and automation of our healthcare service. And lastly, more related to the first point, a broadening of health into non-traditional areas. You're going to see much more emphasis on, diet, prescription of park passes is already kind of a thing in certain jurisdictions. So I think it's going to muddy the waters a little bit, maybe, again, make it a little bit more of a traditional consumer / patient-centric experience.
Amazing. And I think our community is the perfect one to respond to all of these changes. I mean, we've already evolved once with the transformation to digital health from the paper-based world. And so I think we're ready to go for the next set of changes coming our way. Hélène, go ahead.
Well, I have very similar thoughts that Ted brought forward. To that, I want to add is to also continue to contribute to the use of collective data. By that, I mean it's data that doesn't come in just from physicians, clinicians, and et cetera, but also from the patient, that all of us, patients, clinicians, are able to enter data that will help in decision making. And that linking that to AI that could assist with research, treatment, health strategies, etc., and using also to determine some of the healthcare transformation that occurs in the future. It's using knowledge that we currently have and moving it forward, but including the knowledge from the patients, because it seems we do everything around the patient, but we forget the key individual. The other thing is from a futuristic perspective is linking genome and genetics and all of that and the planning and the distribution and providing service to patients. And having patients enter data from their health status within systems that can all become one big pool of information and knowledge that will better the health of Canadians in general. So it's using the tools we have collectively and having a way with the technologies that these tools can all be brought back together to help us in our day-to-day decision making. So for me, those are kind of lofty goals, but I think would benefit the health of Canadians down the road.
Absolutely. And Rod, over to you.
Yeah, what they said again. That's the problem going last. Very, very knowledgeable panelists here. So my crystal ball is absolutely clear up to 5 minutes ago. And going forward, it gets fuzzy real fast. And the research I did on my fellowship paper in 2018 identified that the average half-life of medical knowledge is about 20 years, and that's coming down, but order of magnitude. And if you overlay the half-life of digital health technologies, it's 4 months. So think about your IT specialists who have to constantly be renewing their knowledge on emerging technologies and when they're ready for use. And for me, when you challenge us to think in a 50-year time horizon, it's not adoption of new tech. It's constantly going to happen. We're going to learn from that process, that experience, fail fast, move forward. That is an iterative process. There's, IT and digital health is one of those industries that allowed to have flawed products. And we know that, right? That's why we always have patching and improvements going on to these things. And then it's about how to help those that need to use it effectively to improve their decision making too. Why? Get a better health outcome, ultimately. So as I step back and think about a 50-year time horizon, what I'm hopeful for is that we really see an acknowledgement like the UK, Estonia, and there are some communities in the US that are beginning to think about the concept of digital equity. So as organizations and professionals get digital, we can't create a divide to integrate to the individual being served. So whether you call them a patient, a person, a family, they need to be able to connect in. And that's how you reduce time, cost, and geography as barriers to health. For me, digital equity is really things like broadband internet right across the country that's affordable, that isn't a barrier to participation for those most in need, right? At the end of the day, they are digitally literate. They know how to use the device, whether it's a computer, a phone, an iPad with an app on it. How do I use this to educate myself and participate in the dialogue with my professional? And what the work I did at the Alliance for Healthier Communities exposed me to was the concept of it is not illness and health. In many ways, when you're dealing with a population of homelessness, mental health, addictions, it's the concept of harm reduction. How do we meet that individual where they're at using these technologies and help them move through their journey to improve their health and well-being? Really easier said than done. And it's going to take a 50-year time horizon to see how we can use these technologies and actually acknowledge a holistic view of a person, employment, housing, food security, harm reduction if they're functional users of substances, right? How do we take a holistic view? Employment and education, big elements of this. It's not just a medical model anymore. And digital holds the promise to be able to bring all of those aspects together, not just the health sector, but engaging with the municipalities, with public health, with other sectors that play housing as an example. So I would really, I'm not getting any younger here. I'm not a spring chicken. So I'm looking forward to you guys pushing the envelope to make sure we're using these technologies to help bring this diversity of a personal view, a 360 view of an individual, to identify how best, person-centric, to meet them where they're at and help them move forward in their life journey.
Absolutely, well said. And I really like the fact that you called out that it doesn't need to be perfect. So I think that we do kind of get wrapped up in that a lot. And, the bar is higher because it's healthcare, but you're right, there is opportunity to kind of iterate and make things better as we go. All right, so I will open it up to all of our participants to enter questions in the chat. These three minds are open to you for the next 20 minutes or so. And as we wait for questions, I have many that I think I could probably spend a few more webinars going over with the three of you. But maybe I'll start and I'll reverse the order this time that we go in. I'll start with the biggest lesson learned over your career in digital health. And Rod, I'll start with you on that.
Okay, let me just, so my takeaways, I think, are a few guiding principles. Stay current. Technology changes so rapidly, you always have to be looking for what's next coming down the pipe and using a lens of when is it appropriate for your context, your organization. You get into risk management a little bit, and I'll tell one quick small story. Back in the 90s, Cancer Care Ontario, the preeminent cancer treatment organization in the province of Ontario, was really pushing the boundary on digital and population health. And they were starting to dabble with the early precursors of AI. And one of the research scientists presented at a conference, a CCO conference, and she said, we asked the AI, what's the most cost-effective treatment for a person with this type of cancer? I don't remember what the cancer was. I do remember her answer. And she said, the system came back and said, let them die. So, wow, what a learning, right? That system used the guiding principles it was given, but was inadequate. So thinking more around bioethics and what is the community good that's being done here. You can't just think about a financial imperative here. We have to think about quality. So staying current. And as you know, powers that be gave us 2 ears and 1 mouth. So you should listen twice as much as you talk. Hard to do for some of us loudmouth schmucks, right? But listen, because you will get it, whether it's from a provider or and I used to take a coffee and go sit in the doctor's lounge, and I'd come out with my skin stripped off, but I had great insights. And over about 6 months, they learned to appreciate that opportunity. It wasn't a formal meeting. It was whoever dropped by. And if they were motivated, they would let me know. So that was good. And if I could make a progress on one of their pain points, I made a point to go back and say, thank you for giving me that insight. Here's what's happened. And that created trust, interdepartmental trust, clinical administration, right? The whole bit. So listen to your users, whether they're providers or patients and families. Lastly, act. We often get paralyzed by politics in your organization, by opposing perspectives. Just know that you're going to fail. It's not if, it's when. And when you do, fail fast, move forward, acknowledging, hopefully, you've identified the cause and made an improvement. That is what we're in when it comes to digital health and health provision. It's still a pretty immature field. So we have to acknowledge there will be failures. Nobody is perfect, right? At the end of the day. So having humility and acknowledging that and taking the frustrations and the feedback in a constructive way to make an improvement over time is what you have to be able to look back and say, okay, 2 steps forward, 1 step back, but I made 2 steps forward again. So we are slowly moving forward.
I'm actually taking notes from this session. I'm getting so many pearls of wisdom. Hélène, over to you, a lesson learned.
Well, I want to add, Rod mentioned a number of them, but one of the things that I feel is also important, in addition to what he mentioned, is you cannot do it alone. You need to be collaborative, you need to be team-oriented, but most importantly, you need to listen to the patients and your colleagues. The patients being the key individuals. So listening to patients, what patients are saying, listening to your colleagues with their challenges that becomes opportunities, and then working together as teams, regardless of your role within your organization, regardless of your levels, together as a team will translate to success. So for me, that's probably in addition to what Rod mentioned.
Thank you, Hélène and Ted.
Those just some really insightful comments. I will confess, most of my career, I've been really into like technology innovation, models of care, things that are super exciting, but really only the last 5 to 10 years have I really fully appreciated the importance of policy. So I'll just give 3 quick examples. So one, as you travel the world, you see jurisdictions where smoking is still a pretty popular activity in the community, and you see commensurate rates of lung cancer. And we forget, but it was like a 15-year journey to change attitudes and progress around smoking in public settings in Canada. But you'll see that that's had a dramatic impact on lung cancer outcomes and things like that. So there's a clear example there where public policy had a huge impact on the health and well-being of Canadians. So now if you take that inside digital health, one thing I always took for granted in my career was like, oh, well, interoperability is not a big deal. We did DICOM in like a decade, and it's like true interoperability in every way. And then I entered the world of informatics, like, oh my God, what a nightmare, what's going on? And to this day, we don't have interoperability. And so then I guess I just didn't really appreciate that it wasn't well, obviously I started to appreciate it was not a technical challenge. It's that clearly a policy and governance issue. And then finally, last example with COVID, pre-COVID, we'd have lots of exciting conversations about the value of virtual care, but most people just kind of like shoved it aside. It's like, well, why would I do that? There's no business incentive. There's no whatever. And now we can see that there's actually billing codes now, and there's actually a bit of sense around it. So I think that for me, the biggest learning has been throughout my career that while all these innovations and different ways of doing things are cool, it's only when you wrap your head around policy and business incentives, you can really make significant system level changes. And if you don't have that, there's really not much you can do.
Absolutely, and having that understanding is so important. We have a question from the audience, but Rod, I think you wanted to say one more thing on this.
Yeah, real quick, I was going to build on Ted's comment. One thing I would advise folks as they're looking at new technologies, bringing them into their organization, keep an eye to unintended consequences, right? So the example I gave of Cancer Care Ontario starting to play with AI and not taking that advice because it was inappropriate, early learnings, right? So you got to be a critical thinker when you look at these technologies, and there's always an opportunity cost. You're going to find out, the shiny new thing has a little bit of bumps and lumps and a learning curve, but think about that. And I 100% agree with Ted about policy, creating a framework to help the broader sector move forward, because it can be fairly slow in happening, but a policy framework can help maintain the gains as you move forward. And I think it's, public policy was on my list. I didn't say it, but I 100% agree with Ted. An ounce of prevention is worth a pound of cure. So you got to think about the financial and the economics as much as the potential clinical benefits that can be realized. I think we're seeing more and more benefits with good research and diligence in using these technologies, that this is the way forward for a sustainable healthcare environment. So why aren't we there yet, right? We're a first world country, and there's a lot of other countries a lot further ahead. And I spent 2 years implementing diagnostic imaging repositories. So Ted's comment in that world of DICOM, there's another acronym, guys, if anybody knows what DICOM stands for, but having interoperability is huge. We used to do it by saying we're on one compatible hospital information system, and the data could be shared within the departments. But now in today's reality, we're interorganizational. We're serving a geographic population across independent providers. How do you move that insightful data out of their records and make it shareable to follow the path of that individual patient or client as they move from provider to provider, and ultimately be able to bring that together to say, we've reduced the cost or the burden of care for this population. That's really the ultimate economic model that this stuff has to contribute to, because it ain't cheap. So what's the return on investment? Is it 2, 3 years, 10 years? Gets harder if the return isn't shorter economically, but quality of life, right? Care avoidance. These are elements that need to be quantified to be a part of that dialogue as we go forward. So ounce of prevention, public policy, and watch out for unintended consequences. You got to be turning over stones and listening to the whispers, because that's where you detect those subtle things.
I love that you're also prepping everyone for the CPHIMS exam, CPHIM CA exam, as you're going with all these quiz questions. So we have a couple of questions in the chat, and I'll just open it up to all of the panelists to answer as you wish. So the first is, there is no shortage of new technology in the healthcare sector, but the speed we can implement, procure, test these solutions in the real world is much slower than technology is being developed due to a number of factors, which you've all touched on: budget, politics, etc. What advice do you have for those trying to introduce new digital health technologies into our system? What has worked well and what should we avoid? I know we've covered some of this already, so if you have anything to add, please jump in.
Can I start on that end?
Go ahead.
Sorry, Ted.
No, go
You
ahead.
want to go?
No, go ahead.
Okay. All right. So the last few years of my career, I worked with a think tank in Toronto that was really trying to address this issue. And it really boils down to the idea of risk sharing. So instead of buying a product, let's task the vendor who says their product is the cat's meow to implement and realize key outcomes: shorter length of stay, improved health, however you manage it. So I don't buy a product, I purchase an outcome. So the Mars district in Toronto was really helpful at drafting some of the first contracts that vendors felt they could win on. And then they're incented to ensure that providers were using their solution optimally. And we had an evaluation framework that we agreed to that said, if you achieve these, you get incented, you get paid for your efforts to make that happen in that adoption and use. So I think it's hard. Risk sharing is hard, but I think with the growing complexity of this stuff, we have to really engage vendors, because if they do a vanilla drop of their solution in your environment and you've got to develop it and figure it out, it's going to take a month of Sundays. They're the ones, the architected it, know how to use it, and can work with the clinicians, and you can really be there to learn with them and how it's going in the environment, but also to measure and demonstrate to your board, to your senior team, to the public, that this investment is paying dividends in those key outcomes.
Thanks.
I would like to add the impact. What is the impact of doing nothing? That's always the thing in the back. Yeah, there's benefits, but the impact of doing nothing on patients, clinicians, and the organization as a whole, as you want to transform it. What is that impact?
I'll just quickly summarize, if you look at the tail end of the question, thinking about AI scribing, particularly in primary care practice, I mean, that's worked extremely well. And why is that? Because number one, it's a very well-defined problem. And it's also got a lot of clinical champions who are just sick and tired of doing their own scribing. So what I look for in a successful innovation is first a well-defined clinical problem, a clinical champion, a really robust evaluation framework, and then hopefully underneath all of that, there's some sustainable funding that you can then find to sustain that once you do have the desired outcome. So really getting that problem sharply focused, and then a clinical champion is really the first two steps.
Great insights. I know we're almost at time. I just want to stick one more question in there. What are some key skills or experiences that aspiring professionals should focus on to stay competitive in the field, such as higher education or networking? If you could get specific with your advice, that would be great. Rod,
I'll just jump on this one real quick. I think, first of all, at the beginning of your career, you should try a lot of different things as much as you can. You should also try to develop some sort of more useful foundational things like a PMP, extremely useful credential to have and will serve you well throughout the rest of your career. So getting those foundational elements kind of under your belt, obviously some kind of, health informatics or whatever area of focus you want to have. And then beyond that, then I think it's just getting more focused, maybe after that first 5 years, and developing a deeper expertise in an area that you can then leverage for your future career growth.
The other thing I would add to that is identifying mentors. And you may have one mentor throughout your career or multiple mentors who will help and guide you and provide some experience as you develop those new skills. And like Ted mentioned, is expanding those skills. But with the mentors, what happened is that they will help you focus on key points based knowing you and based on what your ultimate goals are. They will help you in that perspective. So leveraging that experience is key. And again, get involved in different organizations. Such as digital health will also open your horizons.
Rod, any last words?
Yeah. So, having the technical skills and experiences, I think, are stakes in the game. But to win the game, it's your soft skills, critical thinking, communication, team building, because you can't do this alone, like Hélène said, and engaging others. So, and being humble. You're going to get strips torn off of you and you can't take it personally. The fact is they're telling you what's wrong, and that gives you an opportunity for improvement. So I find the last thing that Hélène talked about, lifelong learning. Keep, protect time. We know you guys are stretched for time. I've always described professionals in healthcare as highly competent people stretched to the point of incompetence. We don't want you to get there. So protect your time for learning. I used to have to do it for paperwork. I'd put it in my calendar so people didn't book my lunch hour and whatever. And same with my learning time, whether it's reading or conferences. One of the big paradigms that Zaid brought up in the question here, we have to acknowledge that clinical competency has a brother or sister now called digital competency. And I used to lobby the colleges, the clinical colleges, to acknowledge the importance of digital competency as a clinical skill. And I've been out of that for maybe 5 or 8 years now, but that's where those clinicians are going to acknowledge they need the necessary evil of these technologies in many ways. And the hope is they become, technologies they want to use, that they need to use. And I think DI has been a field that's really pushed this forward. The MRI, the PET scanner, CT, all of these technologies are very robust. And many clinicians wouldn't go with making a diagnosis without those. Same with everything else that has a digital component. We need to get to that degree of maturity.
Sure. I think that question is a great maybe note for Shannon to add more webinars. There's clearly lots and lots of topics for us to cover here. And with that, I just want to thank the speakers so much. Ted, Hélène, Rod, thank you for sharing your time and expertise. And I'll turn it over to Shannon to wrap us up.
Great, thank you. And again, thank you to all of our speakers, and congratulations once again on becoming our newest Digital Health Canada Fellows. Thank you very much to Anne for moderating an incredibly interesting session. I know everyone has a number of learnings and takeaways from this session, and we probably could have spent the entire afternoon listening, talking, asking questions. But thank you all for joining us today. Before you do log off, I'm going to post a quick poll here just to give us a little bit of a satisfaction rating so that we can use when we're planning our next In Conversation With. So again, thank you for attending today. Our regularly scheduled webinar Wednesday will take place tomorrow at noon, and do hope you will enjoy the rest of your day. Thank you.